Viewers, we are here at the paramedic response unit in Newmarket. A response unit is a kind of a station where the crew and the ambulance trucks are based. And with me is Darren, who's on duty right now.
Now we're entering the crew quarters.
Okay.
And this first part of it, this is where we keep our batteries and the chargers. So these are for defibrillators. So we have to make sure we always have them charged and ready. And those ones are for a radio.
These ones are the radios. So
Portable
this is
radios.
your portable, everything is being charged.
Yeah.
Right.
The red phone's a direct line to our dispatch.
Okay.
So they can call us to give us calls. It's used as a secondary method to call. Our primary one's through a paging system that comes overhead. And in this room is what we call the Pyxis room.
Pyxis, all right.
Pyxis. All right, so this is the Pyxis room, and this machine's called the Pyxis. It's where we come get our stock. It keeps a track, a running count of what we have in it. So each employee is given a login name, and you scan your fingerprint so it knows who's entering here, because we keep a lot of medications and things.
So this cabinet here has got extra medication other than what you have in the ambulance?
Yeah. So if you do a call and use some medications or some of the equipment, you have to come here and to restock.
In this station, how many crews are there at any given time?
Normally there's three. Sometimes.
3 sets of crews?
Yes. So 6 paramedics.
6 paramedics.
Yes.
How many calls have you had so far?
Today has been pretty good for us, just 2 calls.
Okay.
Yeah.
Otherwise, what is the frequency of the calls? Every hour you're there, or it depends, on days?
It's such a random pattern. Some days you can get call after call after call and be out repeatedly. Other days you could be very sporadic. You could be sitting for 2 hours, do nothing, and then get a bunch of calls in a row. So it's completely random.
One of the most important thing is to also deal with the people and their families in an emergency situation. They are anxious, they are maybe in a panic situation. So I guess one of the most important things for a paramedic is to deal the psychological side of the patient as well as the attendants.
Yeah, you're exactly correct in that. Many times the medical care is the easy part of it, and the difficult side is taking care of the emotions of the family and the patient. Because for us, it's what is very routine, as you said before, is very non-routine for the patient and their family. They're calling 911 because it's one of the worst days of their lives. For us, it's just another day on the job. So we learn a lot of the communication skills over time, being a paramedic, and we also take the theory of that during our college training. We learn how to communicate with people in crisis, learn how to communicate with people with mental health disease, learn how to communicate with people having panic attacks, various different modes of communication, using verbal communication, nonverbal communication, spacing, lots of different techniques.
Now, for the benefit of those who are watching this program, if there is an emergency in the house, if somebody in the house falls sick or has an electric shock or any kind of a medical emergency, what suggestions you as a paramedic should give them that once they call 911, or what information should they give to 911 which can then eventually help you in reaching at the scene and being prepared to handle the situation? And what suggestions or guidance would you give a normal people that what should they be doing in terms of preparation in the house, in terms of their own skills, and in terms of handling such a situation, so that when you come in, your job is easy and the patient immediately has been attended to?
Yeah, that's a good question. Well, there's 2 things that they can do. There's one aspect of that question is the dispatch center will give them instructions over the phone. So when they call, they'll ask very specific questions. Is the patient breathing? Is the patient, moving at all? Do they look like they're, having trouble moving one part of the body? They'll ask various questions. And so the dispatch center will be able to give instructions to them, even instructions to do, say, CPR, to breathe for somebody, to try and get circulation going again in their body. They'll give instructions over the phone. So that's one part. What they can do is just listen to the instructions from the 911 operator. The other half of your question is a good one because it's about prevention. about preventing accidents. There's lots and lots of things that people can do to prevent accidents in their home, not leaving things at low heights, dangerous things, sharp objects, glass, hot things for whether it's toddlers or young children in the home, removing barriers that people can trip over. There's lots and lots of prevention techniques that can be done to stop accidents from happening before they do.
These are the people, viewers, who actually deal with these emergencies on a daily basis. They have tens of these kind of situations on a daily basis, and here you are listening to a guy who's actually telling you how you can save lives. If somebody was in the office or at home qualified or at least knew what to do, and that saved the life of that person. And that person could be us, could be me, could be you. You are doing something saving humanity. Because as it says in the Quran, chapter 5, verse number 32, that if you save the life of one person, it is as you saved the entire humanity. So people like you are the real heroes. You're the ones who are saving humanity. So I thank you very much, and I wish you all the best.
My pleasure.
Newmarket, Cody Hamilton from York.